Hi everyone, I'm Alison and I'm a trainee clinical scientist from Newcastle Hospitals in the UK. I have nothing to disclose and I'd like to thank the ICS very much for part funding my attendance here with a travel award. So measurement of urine flow rate is very well established in the specialist assessment of men with lower urinary tract symptoms. At present in the UK, it is not recommended for use in primary care because there are a lack of studies of its efficacy in this setting. So we conducted a pilot study of home uroflowmetry in the initial assessment of men with lower urinary tract symptoms with the intention of investigating feasibility and patient and GP opinion. So 24 patients, male patients with lower urinary tract symptoms were recruited across 5 local GP sites, and we asked all of the patients to use a simple and single patient use electronic flow meter at home to record as many of their voids as possible for 1 week. The flow meter, which was developed in our department, obtains multiple urine flow curves and an electronic frequency volume chart from which various storage and voiding parameters can be calculated. Following use, the devices were returned to secondary care and a report was generated for the GPs. Patients and GPs were asked to provide questionnaire feedback on use of the device and the report respectively. So first of all, we compared patients' symptom scores to data from the home flow meter. And we found that nocturia and frequency symptom scores showed much better agreement with equivalent objective measures from the flow meter than weak flow scores. And this indicates that patients are relatively poor at judging their own flow rate. And this could in part explain the high failure rate in primary care of medications intended to improve flow rate when prescribed on the basis of symptoms alone, as they are. So patients were asked to score the burden of using the device at home and their willingness to repeat the investigation again in the future. And the majority of patients gave the lowest burden score and the highest willingness to repeat score. GP feedback of the home flow data included the following. It enabled better evidence-based treatment instead of a trial of treatment, improved patients' quality of life more quickly, prevented the need for some referrals, added weight to attempts at managing patients' care in primary care, and gave the confidence to reassure men whose results were normal. So in conclusion, the use of home uroflowmetry in the initial assessment of men with urinary symptoms is certainly feasible, and GPs in particular were very enthusiastic about the potential benefits. Objective measurement of flow rate, frequency, and nocturia would allow GPs to make more effective medication decisions. And the next step for us is to look carefully at the output from the device so that the report can be interpreted by a non-specialist. Thank you.
Are there questions? Yes.
Alison from the UK. I'm sorry, but the obvious question, I suppose, is how much is the device going to cost, or is it in production? I'm assuming you're going that route because you've got the...
Yeah, exactly. I think that's still something that needs to be decided for sure. But it would certainly be, if compared to the tariffs and things that are associated with uroflowmetry, it would certainly fall underneath within the cost for those tariffs.
Bernie Halem from Sydney. This looks excellent. What kind of transducer principle are you employing with this, and have you done validation studies and things like that?
So it's a weight transducer, and we have lots of information on its accuracy, and it's at least as accurate as the kinds of devices that you have in clinic.
Plus or minus 5%? What did it be?
Within plus or minus 5%, yeah.
Okay.
I have a question about the training required by the person who uses it. Do they need a health professional to instruct them how to use it?
It's a really simple concept. So the device is activated with a battery pull tab once, and thereafter, all that they have to do is put the jug on top of a sensor each time they void. So that's the extent of the instructions that you need. as I've said in the abstract, there was one patient who didn't provide data with the device, and that was probably due to miscommunication about its use. So as long as you've got that brief instruction down to a T, it should be fine.
Leslie Belfi from Canada. I'm working in a GP's office now, so this is very interesting. I'm wondering, that one device, do you use it for multiple patients? Do you just send it home and recalibrate it for each one? Is that what you're doing?
So it's single patient use for reasons of kind of cleaning and the fact that it would need to be tested to be accurate after use. We've decided to make it a single patient use. And I've looked into how we would deal with that in the hospital, and there are mechanisms in place for appropriate disposal afterwards.
I was thinking of it more on the lines of being able to use it in clinic, because it seems quite simple.
Yeah.
And then you could use it multiple times during the day for an accurate flow meter there.
I think it's not the intended model that this is something that we used in the clinic, and it's designed specifically for home use, so it's not intended to be in competition with those sorts of
but I'd
devices.
love to have one. Anyway.
Thank you. We'll have to move on to the paper.
Okay.
The next paper. Thank you.
Thank you.